Okay, knee assessment then. So actions available at the knee. Go. Flexion extension. Lateral medial rotation, yeah. Often called tibial rotation. So we're trying to keep the knee fixed and then to rotate with everything above the knee fixed, basically. There are certain things that you want to look at as far as part of the assessment goes, so patella movement, palpation. Don't forget parts. So asymmetry, that's your posture assessment. Range of movement, that's your joint tests. But don't forget tenderness on palpation, fatigue, special tests as well, which we look at with the ligament tests. So first, flexion extension then. Can you just straighten your left leg first? Straighten left leg out for me, good. And then relax down. Okay, so that was active extension. Okay. We can look at tibial rotation from there as well. So you can kind of fix your knee and then just rotate. We're always going to get some hip rotation there with it as well. What's another way that we could rotate the tibia independently of the femur? We could do it from the proximal end as well, so we could fix the foot. So if you put the foot down on the floor, and then you can just rotate around. So similar to a kind of meniscus test, that sort of thing. Try and sit yourself down on the couch so that your weight bearing as well. Drive the foot down into the floor, and then just a bit of rotation. Okay, so we're kind of reenacting that McMurray's test for the meniscus. Other things that we could do that would cross over for the hip as well, so we could get them to stand up, sit down. It's hip extension, but it's also knee extension. So if you go down on your back then for me. So we'll keep it nice and simple, and you can add embellishments if you want as you go. So we'll take a look at knee flexion first, active knee flexion. I'll do it with the towel actually. So if you go knees up for me, and bring both your heels into your butt. As far as you can go, so we can have a look there to see if there's any discrepancy in the amount of flexion that we've got. You can see that where the toes come to. Also have a little look from this end and just see if we've got one knee higher than the other. Could indicate a leg length discrepancy, tights in the quadriceps. Okay, legs down. Good. And if you want to look at active extension, you need somewhere for that knee to go. So I'll start with a degree of flexion. It also allows you just to hold those quadriceps down into place, hold the femur down in place, and palpate the quadriceps. So if they've got not much of a contraction through vastus medialis, we can cue that by just pressing into that. It's quite helpful. Okay, so just extend the knee for me, straighten the leg. Good, and down. Perfect. Okay, so active extension, active flexion. We do that in prone, but we'll finish off with supine before we move on. So passive, I want you to practice this and get comfortable with the knee and with the position that you've got the leg, because there's a lot, much like the Ovis test, that you can do from this position. So we can look at flexion. Don't really get any pain because you've got a bit of pain in this knee. Okay, so we're looking for what kind of a feel for the end feel there. Yeah, like a soft kind of elastic end feel. Okay, so we've got that, and then we can also look at passive extension. So we're going to fix the femur in place just above the patella, and we're looking for. So anybody know how many degrees of extension we should expect? About 5 degrees of extension. So just enough to get the heel off the couch, basically, is what we're looking for. Okay, and if they get pain there, it's okay.
No, that's fine. Yeah.
Good. Okay. If they get pain, or if there's notable restriction one side to the other, then it's something worth looking at. So from there, with supine, we'll go into the ligament tests as well, because they should flow one into the other, and you've got your list there just in case you do need to refer back to it. So from there, I'll probably go straight into a McMurray's test. So McMurray's, we're looking at the meniscus, and it's a combination of tibial rotation, which we can do. Let's do that first actually. So tibial rotation, we're keeping the femur fixed with hip inflection. You can hold that there as well. You can palpate that tibial plateau, just to make sure that you've got independent movement of the tibia and fibula, and you can feel those rotating. Okay, so all McMurray's test is, it's a combination of flexion extension and tibial rotation. So palpating that tibial plateau sometimes might be enough to trigger the pain if they've got a tear in the meniscus, and it will also allow us to know that we're actually doing something we're trying to achieve. Bit of pain there.
Yeah, it's fine. It's fine.
Yeah?
But yes, it's a little bit.
Did it look fine?
It's just sort of tender. It's not. Yeah.
Okay. Is it where I'm pressing in?
Yeah.
My fingers.
Yeah.
Yeah. And is it a meniscal tear?
I had one a couple of years ago. Yeah.
Okay. So it could be some scar tissue in there.
Yeah, probably.
Okay. So nice and gently first, and you're just trying to really get those femoral and tibial condyles to collide, essentially. And if there is any meniscus in there, you're trying to kind of sandwich it in and pinch it. Not too painfully, hopefully, but that will point us in the right direction. So slow, small circles to start with, Then you get bigger, deeper into flexion, you're more likely to provoke it.
Oh, yeah.
Yeah, and I've got control over that here, and I can actually feel something kind of popping over that tibial plateau there. Was it medial?
Yes, I mean, I also did my ACL, my MCL at the same time.
Oh, well done.
Yeah.
Yeah, so that's O'Donoghue's triad.
Right.
Did you know that?
No, I didn't. I like that.
Yeah, so 3 ligaments that can all go, they've all got connective tissue connections.
That's quite cool.
Okay, yeah, so and we know your history there as well, so that's understandable why it's going on.
Yeah.
Okay, so that's your McMurray's test. Practice that. I want to see your hands in this position, control over the calcaneus, giving yourself tibial rotation. A lot of people do it in different ways. That's the best way as far as I can see. So from there, we're looking at ACL, PCL. So we're going to fix the foot in position, and we're looking to palpate that tibial tuberosity with the thumbs, and then just to give it a little pull. Did you have ACL reconstruction?
No.
Okay, I feel a bit of a click in there.
Yeah.
But it all adds up with what you said.
Yeah.
Okay, and then posteriorly, we're going to push posteriorly and see if we've got any laxity in the PCL, which actually I'd say we have. But we're always going to compare that to the opposite leg and see, is that normal, Sarah? Okay, and from there we're going to go into an MCL valgus stress test. So we're getting the leg in a nice, secure position, applying a bit of valgus force through the outside of the knee. Nice and relaxed for me to hurt.
No.
Bit of apprehension there.
Yeah, that's what it is.
So I'm pushing through to see if we get any separation of the tibia and femur. We can give different degrees of flexion. Obviously, when we get to a certain point, there'll just be internal hip rotation, so we're kind of run out. Okay, and then we can also look at the LCL. So we can apply a bit of varus force. So you can do that through tibial rotation, and you can also do that through a little push through the varus force. Just be mindful that sometimes the pain there can be you putting pressure on the medial aspect of the knee. So if they say ouch, ask them where the pain has come from. Okay.
So just to know you're pushing out of the knee and
Yeah, I'm fixing the ankle here,
yeah, so
And
you're
then
not
I'm
pushing
pushing the
it out,
knee.
you're just fixing it.
out into varus, yeah. Great, okay, you can have a look at the patella as well, have a look for mobility of the patella, just make sure that the knee is in extension, because any flexion there will tension that patella ligament and the quadricep tendon. Just go face down quickly, Sam. Okay, so just quickly, we can look at passive flexion. We can look at active flexion, so just go both legs at the same time for me. Okay, and again, we can use that to gauge which one is more mobile. Nice and relaxed for me. We can look at tibial rotation here as well. So I actually prefer this one here because you're keeping the femur nice and fixed and then rotating. And that's also going to test the meniscus as a variation on McMurray's. Okay. And that's it. Any assessment? Happy?
Thank you.
Any questions?
I've got a question.
Yeah.
When people talk about tapping the patella if they've had any issue, what I mean, obviously you just did the movement around it, but if we wanted to look at tracking, that's making movements a functional thing, right? If they're doing.
Yeah. So something that you can look at there, usually what you get is runner's knee, which is a broader term, specifically something called chondromalacia, which is the wear and tear of the cartilage on the back of the patella and the femoral condyles. So if you lie down on your back for me, sir, there's a special test. I'm not going to show you all the special tests because there's just too many and it's too much to think about. But you can do a test called Clark's sign, which is you're basically pushing that patella down into the femoral condyles and seeing if that triggers any pain, and that we wear and tear that cartilage on the back of the patella. It's quite uncomfortable anyway, so you can get into tension that patella in further by just slowly contracting the quads for me as I put pressure down. Okay, relax. Okay, contract the quads. So you want to try and think about extending, no, that's your hamstring. Think about extending your leg like that. Okay, relax for me. Okay, so we're going to push down into the patella, quite uncomfortable anyway, and then slowly tense the quads up. Good, and that feels okay. If I was to do it to this side, then yeah, we might get some pain. Then you're going to start to look at what has control, usually over the lateral aspect of the patella, because they're the muscles that bring it laterally, which is the most common type of maltracking. So that might be vastus lateralis, be the IT band, that would be coming from TFL, so you're looking at everything laterally. You cross that bridge when you come to it. Okay, but that's just a whole other subject that you can write essays on. Okay?